Hi guys, good morning, good afternoon and good evening. Welcome to this quick discussion for NEET PG 2025 PSM. Number of questions this time in PSM where as usual routine 20 questions with 18 questions being from notes. As usual 2 questions were outlier. Out of this 18, 15 were absolutely easy and direct. It was those 3 questions for which you actually built concepts, and out of the 2 outlier questions, I hope you could guess 1 right. So I would be expecting you to get a score around 18 to 19 out of 20. Now, if anyone has got 20 out of 20, hats off to you, because it is not that easy. Again guys, please understand these are absolutely recalls from students, so there can be some differences in answers across various platforms. Do not worry here, because you exactly do not know what the NEET PG people have taken, because the wordings we do not exactly know. Okay, so this discussion will be in 2 parts. The first part I will be taking, the second part Kashish sir will be taking. So we have split up 10 questions each, and together we form the DAMS PSM for you guys. So one new intervention testing was to be done, for which 2 groups were formed. Now please mark the word groups. It is not individuals. 20 for standard PHC care and another 20 for interventional care. What study will be helpful? Now guys, when you are talking about groups, the answer should tip towards cluster. If it would have been individuals, we should have talked about a simple RCT or a quasi-experimental. So a quasi-experimental is a non-random. Now there are few people who say that the answer should be quasi-experimental. Answer is no. Now the reason they say answer is quasi-experimental because random nahi diya hai. Guys, please try to understand. Exam mein they would not give everything in the question. You need to pick up other keywords. So the keyword over here was group. So group is a cluster. So it is a cluster randomized control trial. It cannot be a case control or a cross-sectional, because first and foremost cross-sectional mein comparison group nahi hota hai. Yahan pe we do have a comparison group. Again, it cannot be a case control because we are having a prospective look into it. It cannot be a cohort because in a cohort there is no artificial intervention. I hope I am clear with this, and I am killed the controversy by giving you the concept about it being a cluster randomized control trial. Keyword a group. Arrange the following in the correct order. The second question from epidemiology. Yes, randomization is done first. There is no doubt. Statistical assessment is done last. So I would first and foremost look into the options where A and D are at the first and last. A, C, D. Answer was B. So you need not even think about anything else. Now, guys, in a randomized control trial, we see from treatment to the outcome. So there is a follow-up. Now, this manipulation was a very non-technical word over here, but again, option dekhe you needed to decide where to put manipulation. So it was very clear. It is A, B, C, D over here. Okay. Now, compare mean. Now, mean makes this a quanti one. 2 different groups, different, so it is unpaired. So this is a unpaired t-test. It is not a paired t-test because then the data would have been paired. If there would have been more than 2 groups, it would have been ANOVA. If it would have been quali, then only it would have been chi-square. Okay? A district survey report says due to new screening methods, 5-year survival of breast cancer increased. But autopsy surveys revealed that there is no change in mortality. That means there is a false increase in the survival. So there is a bias. This is called as lead time bias. A simple example, suppose a person is diagnosed with breast cancer at 40 and dies at 60. You diagnose at 35, but the patient dies still at 60. Patient hardly got benefit. Rather, you screwed up the patient by diagnosing earlier. This is the condition, lead time bias, asked over here. Now guys, these 4 questions were from EPI-STAT screening. Generally from EPI-STAT screening, we expect 6 questions, but this NEET, they put up 4. So I will still say, ki boss, there was a good representation of these topics. Now, no siphon tube, larva lies parallel to the surface. Direct question from the class, from the DVT. This is Anopheles. Anopheles is parallel to the water surface. Now I am talking about a larva. The adult is sitting at an angle. Here they were asking about a larva. Now Anopheles typically presents like a boat-shaped one, whereas Aedes, even though single, is convex and it is lies perpendicular. Culex again perpendicular and it is generally present as cluster. C for culex, C for cluster. Mansonia is star shaped. So answer to this question was Anopheles, and that is the reason maximum antilarval works against Anopheles only. 70 lakh population with 30% slums. How many UPHCs as per the norm for the slum area? Now guys, UPHCs are generally set up in the slum areas. So 30% means this was more of a maths ka question where you do into 70 lakhs, you will get around 21 lakhs. You know, one UPHC is built up at a population of 50,000. So this was the background concept which you were supposed to know for this question. So number of UPHCs 21 lakhs by 50,000. Answer to this question was 42. So answer to this question was option number C. Calculator was given, so it was not big deal for students to solve this question. A 58-year diabetic patient was diagnosed with COVID-19 and admitted to a district hospital. He succumbed to death within 7 days. His death was recorded in the hospital. This type of surveillance is, see, you are not going anywhere. The patient is at the hospital. So it is passive. It would have been active if you would have gone to the community and tried to look. It is not a syndromic surveillance because it is very evident that you are talking about COVID. You are not talking about acute encephalitis syndrome or sexually transmitted infection or reproductive tract infection which works as syndromes. Here it's very specific disease, COVID-19. It is not sentinel because you are not looking into the missed cases per se. So this was a very, very clear-cut application-based question on passive surveillance. One question from management. Now, there was one more question from management. I will just show you that first. That was this, the definition of evaluation. So, used to measure the degree of objective and target achievement, you will look into the quality. So, it is evaluation. Monitoring is done by internal person. Evaluation is done by both internal and external person. So, again, two questions as expected was from health planning and management. A recent leak of factory fumes has been noted. What advice will you give to the people? Now guys, per se, there is no clear-cut reference to this. But here comes a play of a bit of common sense, and I would say this was a more of a common sense based question. Seal all the creaks and walls. You know, by the time you seal, the person who would be sealing would have died. Second, gas and water cannot be sealed unless until it is airtight. One of the best example was the Titanic movie. They were trying to seal the water, but water gushed in. Same happens with gas. Contact friend via phone. It is not a KBC where you will do a phone call to your friend. Open all doors and windows for ventilation. Yes, this would have been a good option, but please try to understand, whenever you are opening, you are still in a closed limited space. So the chances of the gas concentration going up is very high. So better is to evacuate immediately. So you leave the space and go to an open space, because when you go out, the gases will diffuse out in the open space. See, even if you stay inside a room and the gases will slowly diffuse in, so you will be behosh inside. Rather than if you go out to an outer space, there is a clear-cut diffusion. So it becomes better. So whenever there is a gas outbreak, gas leak, we say people just leave your inner place and go out. Yes, go to the open, because over there the gas will diffuse out rapidly. Okay? Now, there were few students who said without any information, yes, it's a panicky situation. Do you think you will sit in the room for 1 hour that the DM gives an announcement, कृपया करके अपना घर खाली कर दें? By the time you would not have खालीed your घर, you would have खालीed the earth. ठीक है? In the census of India, de facto system is used for collection of data. This implies that the data is collected for. Now, guys, there are two methods. One is a de facto, one is a de jure. I don't know why they asked this, because de facto was a method which was done before 1941. At that time, none of us were born. De jure is done now. Very simple understanding. Your friend Deepu, she is from Bangalore and she studies MBBS at AIMS Delhi. De facto means she will be counted in Delhi because she is staying in Delhi. De jure means she will be counted as Bangalore. So guys, de facto means wherever the person is present during census would be counted. De jure means whatever is the original residence of the person will be counted accordingly. Yes guys, this my dear students is all about the first part of discussion. Upcoming is Kashish sir who will take up the second part of the discussion. If you have any queries, please feel free to drop me a message on my WhatsApp group, or you can also drop me on Telegram for any queries. Guys, I hope you have rocked the exam. All the best, and trust me, do not worry, whatever is gone is gone. Now let's go the way ahead. All the best guys. Bye-bye.
Now I'm starting with the recall. And if I talk about the first question, mother diagnosed with HIV at 34 weeks. Treatment was given. Viral load. So in this case, the viral load, the mother viral load is 1200. The mother viral load is 1200. They are asking about what to be done. Guys, in this case, whenever we have one HIV pregnant women, we look for the viral load. If it is less than 1000, if it is less than 1000, we say that mother is a low risk mother. But if the viral load is more than 1000, we say it is a high risk mother. We say it is a high risk mother. So in case of low risk mother, we only give nevirapine. We only give nevirapine. But if it is a high risk mother, we give nevirapine plus zidovudin. Plus zidovudin. Right? So rule out this option. Rule out this option. Now option 1 and option 4, it seems like they both are similar. Right? Now, whenever the mother is planning exclusive breastfeeding, if the mother is planning exclusive breastfeeding, the guidelines say 12 weeks. The duration for nevirapine plus zidovudin is 12 weeks. And if the mother says she will be doing exclusive replacement feeding, then 6 weeks. The duration is 6 weeks, right? So the same algorithm I taught you in my back to basic lecture, my face-to-face lecture, and also in DAMS DVT. The same thing was taught to you, right? Now, coming to the next one. In case of HIV-TB co-infection, we start ATT, then after a week, 2 weeks, actually the guidelines say 2 to 4 weeks, right? But 2 weeks is considered. Then we start ART. ATT is started first. We do not start both together because of the possible side effect that is known as iris. That is why we treat TB first, then we start ART. TB, we need to start it first because TB is contagious, and within 1 to 2 weeks of starting ATT, the infectiousness decreases by 90%. That is why we start here ATT and then we start ART. The exception is TB meningitis. In TB meningitis, the duration is not 2 weeks, it goes more than 4 weeks, up to 8 weeks, depending upon the condition. So the answer is here, the correct answer is 2 weeks. Again, I discussed the same in my back to basic. It is there. Coming to, guys, this is the program and the name of the program is IYCF, Infant and Young Child Feeding, right? It is IYCF, Infant and Young Child Feeding. Infant and Young Child Feeding. Guys, infant and young child feeding, the guidelines say that if the baby is 6 to 8 months, if the guidelines say if the baby is 6 to 9 months, in fact, we give few spoons to half a katori, and that too 3 times a day, and that too 3 times a day, right? So many students told me that it was only half a katori was mentioned. Even if it is a half a katori, or here it was 1 katori, right? So the correct answer, if this was then the correct answer will be half to 1 katori for 3 times a day. But if it was there like few spoons to half katori, that is the best answer than this option, right? And if it is only half katori, then also that is the good answer, right? So all I mean to say is from 6 month to 9 month, according to the program infant and young child feeding, few spoons to half a katori is given 3 times a day, right? It's given 3 times a day. Recommended cholesterol level to prevent coronary artery disease is 1000 per 1000 kilocalorie. These are the recommended cholesterol levels. Now coming to, guys, please understand this question, please understand the controversy, please. I totally understand your doubts, I totally understand the confusion going in your head, but please you try to understand. There was a program, weekly iron folic acid supplement. This program started with 100 mg iron and 500 microgram folic acid. Then this program WIFs started, and then started Anemia Mukt Bharat. Under Anemia Mukt Bharat, there are 6 beneficiary, and out of that, 1 beneficiary is 10 to 19 year adolescents. Here also this WIFs was for 10 to 19 year. Anemia Mukt Bharat, it came as an umbrella program for the anemia. So many interventions, so many beneficiaries were there. And then under Anemia Mukt Bharat, 10 to 19 year, the answer 60 mg. But the WIFs started, which is a old thing, and under Anemia Mukt Bharat, these are the new guidelines. These are the new guidelines. As per the new guidelines, as per the available evidence, the answer, the best answer here should be 60 mg plus 500 microgram. Now, time taken between from the entry of organism to the maximum infectivity. Entry of organism to maximum infectivity, it is known as generation time. It is known as generation time. A 3-year-old child with bowing of legs. Which team is responsible for help? Guys, 3-year-old is not going to school, so rule out midday meal. Anemia Mukt Bharat, it is not related to anemia, it is not related to iron deficiency, it is not related to other causes of anemia. Here the best answer is ICDS. ICDS is responsible for giving the child supplementary nutrition. ICDS is responsible for the health and also the nutrition education. This is the responsibility of ICDS. So best answer here will be ICDS. Guys, there are 4 stages. 1, 2, 3, 4. There are 4 stages of VVM. vaccine vial monitor, these two stages, the inner square is light and the outer square and the inner square is dark here, right? So they're asking you, out of 4 VVM stages, which will you use in your clinic? Guys, we do not use these two. We only use 1 and 2. We only use 1 and 2. In the Chittor district, in this, they are telling that there is a district of Andhra Pradesh, a person was found to have knee deformity involving outward deviation. So this is a clear-cut case of fluorosis. And most likely, because they are telling that there is a knee deformity, it should be a case of skeletal fluorosis. In the case of skeletal fluorosis, it is because of high fluorine in water. And we need to do some interventions which decreases the fluorine in water. You change the water source, have water from places which are having less fluorine. You provide fresh drinking water, you add alum plus lime, or you can say Nalgonda technique, right? But if something is happening already because of high amount of fluorine, why you want to add more fluorine? Fluoride supplementation is not given. Also, I want to tell you that fluorine is a double-edged sword. If it is high in water, it causes fluorosis. And if it is less in water, then it causes dental caries. This is the reason why some toothpaste, they have high fluorine level to prevent from dental caries. In this already fluorine level is very high. Why you want to give? So fluoride supplementation. A student was asked to pick the right boxes for defluoridation. Guys, let me tell you few points about defluoridation. Point number one, the defluoridation. The name of technique is Nalgonda technique. This technique was developed by NEERI, right? Environmental Institute. This is NEERI. This was developed by them. It says lime, alum. Guys, in my back to basic, in my face-to-face classes, I told them that this is a very old PYQ. When I was a student, this type of MCQ was very common. I have told that. This is the perfect example why we should not ignore the old topics as well. They also repeat, right? So here, lime and alum. Now, coming to this question, POXO Act, it is applicable for every child. This act prevent children from sexual offenses, and this act is applicable on all the children less than 18 years. On all the children less than 18. For example, the pornography, the child pornography, and all of these things, this act makes sure that the children should be protected from all of these activities, from the harassments, all of these activities. So children, girls less than 16, no. Girls less than 18, no. Any child less than 16, no. Criteria is any child less than 18 year. Any child less than 18 year. So guys, with this, thank you so much. So these were the recalls, and again, these are, as we have already told, that there might be changes in the language, there might be changes in the language of the option, there might be changes in the, right, but this is the best recall which we could get. I hope the concepts are clear. Thank you so much.